It's 3 o'clock on a Sunday afternoon, and you've got an appointment with your doctor. Hi there, everybody. The finest doctors in town are on call for the next hour to share their knowledge with you and to answer your questions on today's topic, as Caribbean Surgery Inc. and TVG 28 welcome you to Health for Life. This is the first of a medical show on television that deals with prevalent health problems and concerns, and they do so in an easy-to-listen-to question and answer format. To find out what we're discussing today and to introduce us to the visiting specialists, here is the producer and the host of Health for Life, Dr. Surendra Prasad.
Good afternoon, my TV viewers and radio listeners. I am Dr. Surendra Prasad, welcoming you to the first of 14 episodes of Health for Life. Health for Life is a program meant to inform you, the public, on common medical issues and conditions that you may have questions and concerns about. Health for Life is the brainchild of Caribbean Surgery Incorporated, and we have successfully teamed up with TVG and Guy Enterprise to break new ground, reaching out to audiences on television, radio, and internet in Guyana. Today, this program is being broadcast on TVG and is being simulcast on Radio Guyana Incorporated. Our viewers and listeners can also reach us in a number of ways, including standard telephone, text message, WhatsApp, Twitter, and of course, the ubiquitous Facebook. You'll learn more about these on subsequent programs. So today, this program is being seen, heard, and communicated to the widest audience possible in Guyana. We ask that you sit back, relax, and lend us your ears. We promise to inform, raise your awareness, and create a platform for constructive discussion. Health for Life will be a weekly program covering a broad range of topics over the next 3 months, and we will be here every Sunday at 3 p.m. on TVG. The first 6 episodes will look at issues related to women's health and pediatrics. Today, we will be discussing fever in children. My guest physician is Dr. Rohan Jabour. Dr. Jabour is a well-known pediatrician who works primarily out of the St. Joseph's Mercy Hospital. Please stay with us. We will be right back with Dr. Jabour after these messages.
International Pharmaceutical Agency. When we started out, we were thinking of supplying everything medical. That's what we do now. General medicines, yes, along with equipment for the dentist, eye specialist, ear, nose and throat specialist, gynecologist, heart specialist, pediatrician, caregivers, and everything for hospitals big and small. So it's no surprise that today IPA is the leading supplier in the medical profession. International Pharmaceutical Agency. The nation's health is our concern.
Introducing the new Lotto Super 6. You knew it as Lotto before. The jackpot with the biggest cash payout. Now easier than ever to win and win more often. For only $200, you can pick any 6 numbers from 1 to 28 for your chance to win the jackpot. Get 6 numbers and the jackpot is yours. You can win if you match 5 numbers plus the bonus ball. Match 5 numbers, match 4 numbers, match 3 plus the bonus ball, or match the letter and get a free ticket. Still drawing twice weekly. Your chances of winning are even better with the new Super 6. Remember, a ticket a day could make you rich today.
What price do you put on your life? In emergencies, when you need to get help fast, the Berbice Bridge gives you the assurance that you can make it every hour, every day. And when it's a question of traveling safely, the people at Berbice Bridge take pride in their maintenance program that keeps the bridge trouble-free and very safe. Now your friends and family in North America can visit more often. The Berbice Bridge, saving time and money, saving lives.
Welcome back to Health for Life. My guest physician is Dr. Rohan Jabour. Dr. Jabour is a well-known pediatrician who works primarily out of the St. Joseph's Mercy Hospital. Dr. Jabour, thanks for joining us and welcome to the program. Good afternoon.
Pleasure, Dr. Prasad.
So, what is a fever, Dr. Jabour?
Now, in order for a human being to survive, their cells must function at a certain temperature. If you go above or below that, it's a problem. That temperature is approximately 37 degrees Celsius or 98.4 degrees Fahrenheit. A fever is any temperature above this.
Now, how do we want our patients, or I guess their guardians, the parents, to measure these temperatures?
There are numerous methods of measuring temperatures. The earliest means that we used were the mercury and glass thermometers. Now, these are quite accurate, but they break very easily and they release mercury in the environment. Modern methods are mainly electronic. Some are accurate and some are not. You get what you pay for. The air thermometer is by far the most accurate, but is very expensive. There are strip thermometers for the forehead, but again, these are not very accurate.
And how do you take the temperature in terms of the temperature at the various sites?
You can take temperatures from various areas. The simplest and most accessible is the air canal. The instrument, however, as I said before, is expensive. Other sites are the axillary or armpit. You can take it rectally or you can take it orally. Rectal temperature should not be taken by inexperienced people. It should be only taken by experienced professionals, as harm can come if it's done by inexperienced people. The toddler's air is usually the best source, or you can take it by the axillary route. Axillary is the armpit. The forehead strips are quite reasonable as guidelines, but they're not very accurate. Older cooperative children can use any of these methods. The different routes require different types of thermometers.
Okay. What are some of the causes of fever?
Causes of fever are quite numerous, since a fever is part of the body's response to help the immune system to function. Most times in children, it is used for infections such as bacteria or viruses. Occasionally, it may be manifestations of more serious disease, such as cancers.
What about teething and its association with fevers?
Now, teething is a very interesting topic. Throughout the pediatric world, there's been tremendous discussions at every level as to whether or not whether teething actually causes fever or the role that teething plays with fever. And there's a lot of anecdotal evidence, but we cannot say that teething does not cause it. We can't refute it in pediatrics.
And why does a fever occur?
Okay, I'll need to explain a little bit about how the body works. Human beings exist in the world today as with every other live creatures that exist. Animals, cats, dogs, etc. There also exist, God made also, germs, and they have to exist as well. What happens when a germ invades the human body, it has the ability to multiply at a tremendous rate and in sufficient quantities that it will overwhelm the body's defense mechanisms. And if it's severe enough, it will cause death. The immune system has the ability to buy time preventing the germ from multiplying. And it does so by raising the body's temperature. And that inhibits the growth of the organism, while the immune system makes specific antibodies to kill the germ. Without a fever, the human body would likely die. For a parent, a dreadful word.
Dr. Jabour, I think it's important to emphasize the necessity of a fever. So why again is it important for a fever to develop?
First of all, what the parent does not really realize is that without the fever, the child will most likely die.
Okay.
And I tell that to parents, they get very surprised. Now, let me explain. By the time the child has had a fever, the germ has already infected the body, whether it's a virus or a bacteria. The human being now has the ability to fight that infection. And it does that by preparing what is called antibodies. Okay? The germ has the ability to multiply by the millions, and it will infect everything, your lungs, your liver, your brain, etc. And eventually it will overwhelm the body. What we do now, what the body does now, on the other hand, it has a system for defending itself against all these organisms. And what it does, it has the ability to make proteins that are called antibodies. Now, it also has the ability to identify the organism, and that specific organism. And then it has the ability to make a protein which will then go and destroy that germ, whatever it is. Now that takes time. It takes a few days. It takes actually between 3 and 5 days to make up enough antibodies to destroy the organism. During that time, it can't allow the organism to multiply like crazy. And what we found out is that if you raise the human body temperature by 1 degree, the multiplication rate drops by half. Raise the temperature by 2 degrees, the multiplication stops. Okay? So what happens now is that while the body needs that temperature, the child is going to have a temperature, and when it's built enough antibodies to kill the organism, the temperature will stop. It will break.
Okay.
And that average time is 3 to 5 days.
You are watching Health for Life. Please stay tuned. After this break, we will continue discussing fever in children with my guest, Dr. Rohan Jabour.
International Pharmaceutical Agency. When we started out, we were thinking of supplying everything medical. That's what we do now. General medicines, yes, along with equipment for the dentist, eye specialist, ear, nose and throat specialist, gynecologist, heart specialist, pediatrician, caregivers, and everything for hospitals big and small. So it's no surprise that today IPA is the leading supplier in the medical profession. International Pharmaceutical Agency. The nation's health is our concern.
Introducing the new Lotto Super 6. You knew it as Lotto before. The jackpot with the biggest cash payout. Now easier than ever to win and win more often. For only $200, you can pick any 6 numbers from 1 to 28 for your chance to win the jackpot. Get 6 numbers and the jackpot is yours. You can win if you match 5 numbers plus the bonus ball. Match 5 numbers, match 4 numbers, match 3 plus the bonus ball, or match the letter and get a free ticket. Still drawing twice weekly. Your chances of winning are even better with the new Super 6. Remember, a ticket a day could make you rich today.
What price do you put on your time? Remember when it took you forever to cross the Berbice River by ferry? The long way to the Stelling, the lining up and the closed gates? Now, the Berbice Bridge gets you across in a little over 5 minutes. Do the math. The toll has never been raised, and it's no more than the cost for going back and forth on the ferry 5 years ago. The Berbice Bridge saves you time and money and never keeps you waiting.
So, Dr. Jabour, we have talked about the necessity of a fever, but how does the body raise our temperature? And what are the times during the day or the night, I guess, when this fever will actually spike and why?
Okay, what happens is that we have a thermostat in our brain that controls our body temperature. And when infection is there, our body has the ability to adjust that thermostat and raise it as necessary. So what will happen is that as the germs multiply, the body will raise the temperature, and then it'll raise the temperature at 2 times in particular. It'll raise the temperature usually between 6 and 9 o'clock at night and between 3 and 4 o'clock in the morning. And what that does is, this is directly related to something called our diurnal rhythm, or our body clock. Our body clock is why we are awake in the daytime and asleep and feel sleepy at night. And so at those 2 particular times, the body will spike the temperature quite high to get the germs under control. And of course, that is the most worrying time for most parents, because it's usually in the middle of the night and no help is available, nobody to call, no doctors to call, and it's usually a very terrifying time for most parents.
As a parent myself, I can identify with that. Now, one of the other challenges that I think I've had and most parents have had is, what should we be feeding the child at this time? There always seems to be some confusion about what we want to feed and what a child is actually going to tolerate.
What we come here to is the basic maternal instinct. The basic maternal instinct is that the mother likes to feed the child. She feels very happy when a child is eating. Now, if you think about yourself, when you have a virus or an infection, do you eat? No. Okay? And so to expect your child to be eating at that point in time is unrealistic. What he's going to need, his body is going to need fluids. Okay? Because when you have a temperature, it uses up water within your system. So the child is not going to want to eat any food. He's going to want water, he's going to want juices, he's going to want coconut water, that kind of thing.
Okay.
They actually did a study that showed that people who have virus infections, if they drank chicken soup, they got better faster than the ones who didn't take the soup. And so that's one of the things I encourage parents to try and get the child to take a little bit of chicken soup.
Okay. Now, you've talked about fever, how the body raises the temperature, and why a fever is important. But there are times when we will give medications to not allow the fever to get too high. What are those circumstances where it's necessary to give medications for the fever, and what are some of the medications we give?
Having said all that I said about a fever, you'd think it's strange that we'd want to give fever medicine. But in fact, you're dealing now with a child, and a child is now maturing. His brain is now maturing, and it hasn't developed properly as yet. And so it's not functioning at 100% the way it should. And what happens when they have a fever is that the brain gets very irritable. And so what can happen in some cases is that they can get something called a febrile fit. Now, a febrile fit will usually occur sometimes in the range of 6 months to 6 years is the average time. They're usually very short-lasting, very brief. And long-term, it doesn't cause any harm, unlike epilepsy or one of those type of diseases. And so because of that fact, if you see a child being irritable and looks like he's hallucinating or something like that, that would be the time you'd want to bring that temperature down and reduce the irritability of the brain. You asked about
the type of medications.
The type of medications. The standard type of medications are what we call antipyretics. The word pyrexia means fever in medicine. And so anti would be something to bring it down. And the 2 basic ones that we use are basically the ibuprofen group of medications or the paracetamol type medications. Now, paracetamol is the British term for the drug. The American term is acetaminophen. So people got to be aware that the 2 names, while sounding different, are actually covering the same type of medication. Okay. And those 2 types of medications is basically what we use.
Now, in addition to medications, are there other measures that a parent or guardian can use to help lower this temperature when it's getting into that range that we don't want?
Yeah. If you're seeing that the fever medicine is not being effective, then what you can start doing is some mechanical methods. And one of the things is to cool the body down. And the major part for a child that you want to cool is his head. And so you can use cold cloths, apply cold cloths to the head. Sometimes people try and use alcohol, and so alcohol is not really recommended because of the fumes that are involved. But you need to bring mainly the brain temperature down so that it doesn't get so irritable. But the other thing that you will do is you can cool the body down, and this is where a mistake is made, whereby they're trying to use cold water to cool the baby's temperature down. What we use is something called tepid sponging. The word tepid means warm. And what cools the body down is the water evaporating from the body. That takes the heat away from the body. And so you want the child, if necessary, sitting in the bathtub with the water just above body temperature. Above all, he must not shiver. If he shivers, the water is too cold. When you're shivering, you generate heat, and so you're defeating the purpose of trying to lower the temperature.
Okay. What is the natural course of a fever?
Keeping in mind what I said before of how the body works, what is going to happen is that between 3 and 5 days is when the body is building up the antibodies needed. By the time it comes to the 5th day, the use of the fever is no longer necessary, and so the body no longer needs the temperature, and the temperature will usually break. Now, there are viruses and diseases that will allow the temperature to go, that the body needs the temperature for a longer period of time. So if you get a temperature going to 6, 7, 8 days, it's not a rare or unusual thing, and it will depend a lot on the type of virus or infection that you're fighting.
Now, this is obviously going to make most parents and guardians very nervous. Their child is having a fever. As you mentioned, when it's going to spike is mostly at night. There isn't, the pediatrician is not there on the phone. What should the parents be looking out for that will make them decide you need to come to the emergency room, or you need to get on the phone and try to get to your doctor?
Okay, most people get hung up on the actual fever, the actual temperature. That's not what is important. The temperature has to be there. The child has to survive. What is important is how the child is behaving. Now, there are two basic types of situations that you look at. One is the child who's got a temperature is reasonably hot. When you put your hand against his forehead or his neck, he's quite warm. But when you look at him, he's active, he's playing, he's looking around. He's ignoring the fever, okay? His body knows that it needs the fever and it's using it. That type of child, you can wait and see, you can watch, because the mechanisms that are going on are what nature has in mind to make him survive. The second type of child is going to be the one who you've given the antipyretics, an hour or two has gone by, you've given both antipyretics together, not much effect, the child remains lethargic, he's not looking around, he's clingy, he's staying near to you, and he's hugging you, and doesn't want to eat and doesn't want to take any fluids or anything. That child I want to see.
Okay. So today we have been talking with Dr. Rohan Jabour about fever in children. And so we're going to ask Dr. Jabour at this point to summarize what are those key points he would like the parents and guardians to remember. Dr. Jabour, what are some of those key points you would like our listeners to remember?
One, fever is not something to be afraid of. The germ that's causing the fever is the problem, okay? And the fever is an essential part of your immune system. And so if a child gets a fever, don't run to the doctor the first 24 or 48 hours. Look at him. Look at what he's doing, how he's behaving, okay? He has approximately 200 cold viruses to meet in the thing. So he's going to get lots of fever in the process of growing up, okay? So when you see a fever, no harm in giving him some antipyretics, but don't keep playing with it. The first sign of it is slightly warm. Give nature a chance to do its job. It needs to do that. Look at your child, see how he's behaving, and go according to what he's dictating to you. And he'll tell you, okay? Just be aware that between 6 and 9 o'clock at night and 3 and 4 o'clock in the morning, it's going to be high, it's going to spike, you're going to need to cool his head down, you're going to give him TLC, and you've got to be a parent to him and bring it down.
And that brings us to the end of the first segment of today's program. Please join us after the break when we will be discussing the questions you have sent us.
Lotto Super 6. You knew it as Lotto before, the jackpot with the biggest cash payout. Now easier than ever to win and win more often. For only $200, you can pick any 6 numbers from 1 to 28 for your chance to win the jackpot. Get 6 numbers and the jackpot is yours. You can win if you match 5 numbers plus the bonus ball, match 5 numbers, match 4 numbers, match 3 plus the bonus ball, or match the letter and get a free ticket. Still drawing twice weekly. Your chances of winning are even better with the new Super 6. Remember, a ticket a day could make you rich today.
What price do you put on a reliable service? In its 5-year history, the Berbice Bridge has never once broken down. Remember the many times when the ferry did and you couldn't keep appointments or ever make it to the airport on time? The staff of 57, mostly Berbicians, make sure the bridge is properly maintained. Yet 5 years later, despite inflation, crossing the Berbice Bridge costs you no more than the ferry did back then. The Berbice Bridge gets you there on time, every time.
International Pharmaceutical Agency. When we started out, we were thinking of supplying everything medical. That's what we do now. General medicines, yes, along with equipment for the dentist, eye specialist, ear, nose and throat specialist, gynecologist, heart specialist, pediatrician, caregivers, and everything for hospitals big and small. So it's no surprise that today IPA is the leading supplier in the medical profession. International Pharmaceutical Agency. The nation's health is our concern.
Good afternoon, viewers, and welcome back to the second half of the talk today we're having on fever in children. I welcome Dr. Jabour back in the studio, and this is the segment where we're going to deal with your questions. As you can see from the television screen, there are a number of ways in which you can communicate your questions to us. You're not going to be able to speak directly to us, but our producer is in the studio, and you can send us your questions by SMS messages, WhatsApp, Facebook, and text messages. Dr. Jabour, welcome back to the second half of the program.
Thank you, Dr.
Good
Prasad.
afternoon. Now, I have seen the first question which has come in from Ms. Singh from South, and it deals with a very common question that myself as a parent, and I'm sure many parents have asked you. Does a fever in a child cause seizures?
As I said earlier on in the program, that seizures is just a symptom, just the way fever is. And there are many causes of seizures. Now, we have to differentiate between the simple causes of seizures that children get, which are what we call febrile seizures, and these are associated with fevers in about 30% of cases of children. Not every child who gets a fever is going to get a seizure. Okay? So you tend to have a predisposition towards it. Sometimes there's a family history of it. And there may be some underlying causes such as prematurity, etc., or a brain that has not developed as well as it should. And so you can then get fevers that are associated, seizures that are associated with fevers. A lot of time people get confused with the word seizure and fit. They're interchangeable, okay? So just keep in mind when you're talking fits, you're talking seizures, okay? And so for the febrile type seizure, that in children, if it's the pure, and we have specific criteria for these type of seizures, okay, which are called febrile seizures, as to distinguish it from the more serious type of seizure, which are not associated with fever, and which you will see in conditions like epilepsy, brain tumors, etc. Okay.
Now, before we get to the next question, one of the things when we're talking about febrile seizures, and as you mentioned in the first half of the program, the tepid sponge. And I find that many parents get confused about the temperature. Could you tell us again and tell our viewers how they gauge what is the right temperature for this sponging?
The major thing I try to get across to parents is to look at your child the child is going to survive. Nature, God has set him up to survive. Humanity's species is supposed to go on. And so there are mechanisms in place to help him. And so he will utilize these mechanisms. And he will tell you, he will communicate with you that, you know, the nature is doing what it's supposed to do. And so I use that as, in my judgment, in terms of when I look at a child, and when I walk into my examining room and I look at the child and I look at the parent, within a few seconds I know, one, I've got to treat this child is very sick, or no, this child is fine, I've got to treat the parents. And so the body language is what tells me a lot. Okay. And so when I have a child now that is sick and needs his fever lowered, the parent has got to look at the child and see how the child is behaving. If the child is ignoring the fever, you ignore the fever. Give nature a chance. If he's clingy, cloaky, etc., then you need to step in. And that's where things like tepid sponging come in. And you've got to understand the mechanism that what you're doing. It's physics now. You need to lower the temperature, and one of the major ways that you take heat away from any body, whether it's human or inorganic, a stone, a rock, etc., is to allow water to evaporate off. Okay. When it evaporates,